Welcome back to another vlog. Today is such an exciting day because I get to start my first rotation in vet school. For the next couple of days, I will be doing my surgery and anesthesia rotation at St. George's University. And basically, this is in preparation for clinical year. SGU does its best to prepare us well, no matter what school we go to. So that's why they do these 1-week rotations. For surgery and anesthesia, I have a total of 3 days that I go into the small animal clinic where I could be doing cat spays, cat neuters, dog spays, dog neuters, and I could be helping out with some emergency surgeries as well by being the anesthetist or being the assistant surgeon or scrub nurse. Technically, my first rotation day is tomorrow. It's currently Monday, and we are supposed to be getting some pre-work stuff to do on Sakai tonight, but we haven't received that yet, and I don't know if we are going to, but I'm going to start by looking at the resources that they have provided to us. I'm going to practice some of the surgical techniques to make sure I'm good with how to do the 3-clamp technique, how to close the skin, how to close the subcutaneous layer, just so I am prepared for tomorrow. If you do enjoy this video, please give it a like and subscribe for more, and let's get into this video. I just got done with studying for a little bit, and I finally did receive an email for what procedures we're doing tomorrow. The plan is we're doing a mass removal, we're doing a cat spay, and a cat neuter. We are split up into 3 separate groups. We are a group of 14 people, so it's definitely a large number of students in the surgery suites at one time. So it's definitely going to be busy. For me in particular, I am scrub nurse on the cat neuter tomorrow, so I really don't know what to expect because we've never done cat surgeries before, and I know that a cat neuter is pretty simple and straightforward. I've watched a couple of videos now on it, but I'm still a little bit nervous because as my job as a scrub nurse, I have to provide the surgical tools that the surgeons will need. We were supposed to have an orientation video as well, but the link is not working for any of us, so we can't watch it. I'm definitely excited for tomorrow. I'm just pretty nervous because we don't know where any of these supplies are. We don't even know what the surgical rooms look like either. We've been to the small animal clinic before, but this is the first time that we're doing surgeries. For my cat neuter in particular, I've been looking at the anesthetic protocols just in case I have to step in, which that rarely happens, but I want to study something and be ready for at least Wednesday and Thursday if I get a cat neuter or spay. And then I don't even know who does the local block on cats. I don't know if it's the scrub nurse or the surgeon or the anesthetist, but again, we'll find out tomorrow. I will say it would have been interesting to do the mass removal. I think I am going to go ahead and get my bag ready for tomorrow. Our shifts for the surgery and anesthesia part is from 1 p.m. to whenever we're done. It says 5:30, but it could always go after that time depending on how long it takes the patient to recover. And then we have to hand off to the emergency team. I know I probably will get some questions about this, so I did want to address it. I still do have actual classes this term, so on top of doing the specific rotations, you also do have other lectures going on, and usually our lectures are from 8:30 in the morning until 12:20. During this rotation, I probably won't be going to class, and I will just be doing the Panoptos online, just so I can sleep in a little bit and make sure I am ready for when it's our time to do surgeries. I'm back from my first surgery day, and it really didn't go as planned. It was a really frustrating day. I'm hoping tomorrow goes better. I'm doing anesthesia tomorrow on a cat neuter, so that'll be my first time intubating a cat, placing a catheter, and prepping it for surgery. Only problem is I don't know the weight of my patient, so I can't even calculate the drugs that I need for tomorrow. And there's no blood work yet that I've seen, so I can't really prepare anything for tomorrow. All I can do is just watch videos on how to intubate and place an IV catheter and kind of see what the normal parameters are for cats. Good news is my maintenance people finally decided to fix my clock, so it's showing the right time now, finally. I'll let you guys know how tomorrow goes. I hope it goes a lot better than it did today. I just made it back from my second day on my surgery and anesthesia rotation, and I wish I could say it went better today, but honestly, I made so many stupid mistakes that I'm just being pretty hard on myself right now. So I came home and just cried for about 30 minutes, but the patient is totally fine. The surgery itself went really well. I just feel like I had no idea what the anesthetist wanted me to do today, and I was messing up on pretty much everything. I did successfully manage to place an IV catheter in the cat, but I blew the first vein, so I had to switch to the other leg. Thankfully, I got it on the second try. We didn't start again until like 3 o'clock, so the procedure itself just took a lot longer than anticipated, so my team was just waiting around for 2 hours before we could really do anything. And then I didn't get to intubate the cat, but we did use something called a V-gel tube, and I will put on the screen kind of what that looks like. Basically, this tube occludes the esophagus, so if there's any aspiration, hopefully it won't go into the trachea, and the tube allows airflow into the trachea so we can provide oxygen and the isoflurane, which is the anesthetic inhalant. So that placement actually went pretty well, but none of our equipment for the blood pressure was really working until later. I didn't get the blood pressure values until like 20 minutes into recording, which is not ideal. Basically, you want to know what your blood pressure is before you start the procedure, so you know if your patient is doing okay. So the rest of the procedure itself went really good. Recovery was really good as well. But then it came to rounds. I didn't know I had to go into detail about my entire protocol when we just finished with the patient. So I was looking pretty stupid, which I really hate, because I kind of wish they had just told me ahead of time that, hey, you're doing evening rounds and you need to present your patient to the doctor again. And then also during rounds, my professor and I were talking about the parameters on the blood work, and she said it's pretty normal for a kitten to have these parameters, but then during rounds, she's like, well, you need to still explain them because they were not within reference range. And then as the anesthetist, you have a bunch of other things to do before you leave. And I had to upload into EasyVet attachments of the pictures that I took of the anesthetic form and then the cage card. And then I had to email it directly to the professor to double check my work. And then I found out my assignment for tomorrow, which I'm not super thrilled with. I'm doing a canine spay, and I will be the surgeon on it. I was really hoping to do a cat at some point before clinical year, but that's definitely not going to happen now since tomorrow is the last day. So I will have no cat experience when I go to clinical year, which isn't good, but I'll learn it as I go. When I get to Virginia. I'm grateful that tomorrow is the last day because I really have not enjoyed this rotation at all, and I'm looking forward to seeing the other rotations that we go through because I'm very hopeful they are not like this. I'm gonna go ahead and try to get some work done and then study for my procedure tomorrow. Because I feel like I don't know the procedure anymore. It's been a little bit, so I just want to refresh on how we do like the tunneling method and the subcutaneous layer. It's officially my final day with surgery and anesthesia, and I am pretty grateful that today is the last day. It's been a rough few days. I am feeling better than I did yesterday when I got back, but I do appreciate the fact that I have done the procedure that I'm doing today before. I actually did it last term. It was a part of my graded portion for J-Cell. I did treat myself a little bit this morning by grabbing a coffee, a truffle ice cream, and a waffle. So when I get back from my procedure today, I will be able to treat myself with a little bit of ice cream for successfully getting through my first rotation in vet school. Thankfully, this rotation alone is worth 10% of my total grade, so it's not worth very much, but still, I wanted to do well on my first one, and I don't know if I really did that, because I really struggled yesterday with anesthesia. I did do quite a bit of practicing this morning, doing the 3-clamp technique, doing my modified Miller's knot, along with the transfixing knot. And I did watch the video from J-Cell that we got last term So hopefully I'm a little bit more prepared for today. Hopefully today goes better, and I will talk to you guys when I get back. I am back from my final shift of surgery and anesthesia, and it definitely was better than the previous 2 days. It went a lot more smoothly. I was actually the assistant surgeon for most of the procedure today, so I didn't actually do the surgery itself, but I was assisting the primary surgeon who was doing it. And she did a phenomenal job, and it was kind of nice to be in the surgery suite for the first time. But I am officially awarding myself with that chocolate truffle ice cream that I was talking about earlier, so I'm going to start enjoying some of this. To close off this video though, it's been a tough first rotation, but I'm kind of glad I started off with this one first because I've heard that it usually gets better after this type of rotation because there's just a lot to know for this rotation in particular, and it's pretty stressful. My next rotation is ambulatory, which will happen in a few weeks. So I definitely will be sure to let you know how that goes because I will be going around the island to check up on our large animal patients and do castrations if they need it, or dehorning. It really depends on what the clients need. They could just have a herd health check, but I will definitely be sure to vlog that time as well so you can see what that rotation is like. I'm definitely going to sleep though and try to catch up on my regular classes because I have not been attending class at all the last couple of days since being on this rotation because I've just been too tired. I hope you enjoyed this video. If you did, please give it a like and subscribe for more because I do plan on showing all of my different rotations throughout the next year and a half, which I'm so excited to share with you. I will see you guys next time.